Dry needling, synonymous with myofascial trigger point dry needling, is a physical therapy technique that uses acupuncture needles to get to the root of the muscular trigger point that is causing structural imbalances in the body. This technique is often confused with acupuncture, but it's important to note that it differs from acupuncture in its use and clinical applications. The main difference being that with acupuncture, the treatment is based on the meridians and the energy flow of the body. With dry needling, the treatment is based on the myofascial trigger point distribution throughout the body. The premise of the dry needling technique is that our nerves innervate our muscles, and our muscles in turn control our bones. This system in our body is collectively called the neuromusculoskeletal system. Our bodies are prone to structural malalignments, from joint inflammation to muscular strains and sprains to spinal compression. It's likely that one will have some type of pain related to the system at some point in their lives. Imagine a car. It has 4 tires, and unless the alignment is nearly perfect, you run the risk of wearing out one tire over another at a faster rate. Ideally, all 4 tires will wear and tear evenly over time. Similarly, due to the nature of our bodies from crossing our legs and having a dominant hand, we tend to have malaligned joints. As a result, the muscles tend to adapt or compensate for such imbalances in our body. To add to this, we're working in front of a computer with poor posture for prolonged periods of time. So as our muscles compensate, some begin working harder than others. This hard work causes the development of deep spasms and/or tightness along certain points in our muscles. Many patients seek massages, and while this can be effective at relieving muscle ache temporarily, as soon as you stand up, the muscular imbalances take over again when you're subject to gravity. So over time, you're dealing with the same tightness that results from muscle dominance due to core imbalances. Dry needling allows us to get to the root of the muscle tightness and spasms that create further inflammation. Once the needle is inserted to the specific site of pain, typically a sore muscle, the goal is to allow for the muscles to release their hold and then reboot. This means we want to hit the off switch on the nerve that is keeping the muscle tight. This is accomplished when the needle is inserted and manipulated into the muscle. The muscle responds by contracting around the needle. The muscle ultimately fatigues and the signal is then able to be shut off. It's like when a computer has so many systems running, causing it to freeze. Ultimately, you have to shut the computer off before it can function normally to your input. So ideally, once the dysfunctional input is shut off, you want to create balanced input. So you retrain your body strategically to promote proper balance in your body. Postural education, balance promoting exercises, and stabilizing and stretching exercises are key in maintaining the gains of such treatment. Dry needling is a neurophysiological, evidence-based treatment technique that requires effective manual assessment of the neuromusculoskeletal system. Physical therapists are well trained to utilize dry needling in conjunction with manual physical therapy interventions. Research supports that dry needling improves pain control, reduces muscle tension, normalizes biochemical and electrical dysfunction of nerve input, and facilitates an accelerated return to active quality of life.